or cheese or butter, this may have this organism. So when a woman who is pregnant, if she takes these things, this organism will very rapidly colonize, yes, colonize colon. Of course, food you're going in gastrointestinal system, my friend. So it will very rapidly colonize colon, and from the colon, of course, then perineum, and then it go to the neighboring area, vagina, and then eventually vagina get colonized with this organism. Right? So this is how the actually mother gets the organism, and eventually it goes to the birth canal or vagina, and then baby gets it from there. Is that right? Don't tell anyone the baby was having the hot dogs and neonate got this listeria. Listeria, mother was having it. You are understanding? Am I clear? So this was about Listeria monocytogenes, right? Now we come to the organisms most commonly producing what? An infant, right? Infant which are more than 2 months. Now why I'm really specifically mentioning infant which are more than 2 months? Actually, the organism which attack here, I'm going to tell you what are the organisms, but organisms which are attacking the infant more than 2 months, usually they do not attack in the first month. Why? Answer is, actually these organisms are unable to attack the baby and produce meningitis or septicemia because defense against these organisms is IgG, immunoglobulin G, which baby has acquired from mother. And as baby become older, maternally transplacentally derived immunoglobulin levels start going down, and now baby gradually becomes on his own. Baby become on his own to make his own antibodies, and if baby is unable to rapidly develop immune response against certain organisms, then those certain organisms pose a serious threat. Is that right? Now organisms which are here is the difference of especially first world and the third world, or poor countries and the rich countries, right? Previously, one of the very common organism was Haemophilus influenzae. Previously, Haemophilus influenzae. Now, Haemophilus influenzae is bacteria. I'm not talking about influenza which is caused by virus. Haemophilus influenzae is a bacteria. Previously, it was one of the very important cause of infantile acute pyogenic meningitis. But now, especially in the developed countries, Haemophilus influenzae is not the major cause of meningitis for infants. Why? Because in the developed nations, or nations who could afford it, and nations who have national plan of immunization, that they are giving immunization, we call it, which is a immunovaccine, HIB, Haemophilus influenza type B, right? Actually, if babies are immunized against this, they will develop antibodies against Haemophilus influenzae, and then chances of babies to develop, you can say, this meningitis due to this organism become very, very less. So what we can say that Haemophilus influenzae vaccination, right, has dramatically dropped the incidence of acute pyogenic meningitis in infants in developed countries or in those nations where this vaccination is done as a national program, right? But as in many poor countries, babies don't have milk, forget about such important vaccinations. So when in developing countries, this vaccination is not widespread and not commonly given to the children, so children remain vulnerable to Haemophilus influenzae, right? So we can say that now Haemophilus influenzae still remain a very important cause of what? Acute pyogenic meningitis in infants in poor countries, right? But in developed countries or where health system is better, incidence has gone down. Am I clear? And another thing which is very important, you can give this vaccination to the mother also, but not after, right? And sometimes what we do that pregnant women, she is given this vaccination. She is given this vaccination at when she is 8 months pregnant. It means 1 month before the baby birth. Mother is given injection of this vaccination. What is the advantage? Yes, my friends. Of course, we are making the antibodies in mother. And that number one, if IgG is made, that will cross transplacentally and go to the baby. More important than that, mother will make IgA, immunoglobulin, against Haemophilus influenzae. Again, let me repeat it. That if we give the baby, the pregnant women, around 8 months of pregnancy, we inject her with this vaccination, right, HIB. This vaccination can also force the maternal immune system not only to produce IgG against the H influenzae, but also IgA, right? And if mother makes IgA, what is the advantage to the baby and how? Yes, doctor. If mother make IgA, right, what is the advantage to the baby? How the baby will be protected against this organism? Yes, Dr. Karna. Okay, one way that transplacentally it will go, but there is another mechanism which also help the baby. Yes, doctor. Yes, doctor.
It can come through breast milk.
Yes, very good. Why you are shying away? That's true. Breast milk, right? What really happens that IgA antibody which mother produces, right? This is antibody is secreted within the GIT, within the respiratory system, urogenital system, and IgA is also secreted into milk. So if baby is on mother milk, right? So every day mother is giving these antibodies to the baby. We gave injection to the mother when she was pregnant for 8 months, and mother started making IgA as soon as baby is born. If mother is feeding the baby on breast milk, then through the breast milk this antibody come into breast milk. And if baby is receiving this antibody, of course baby will be protected against it. Am I clear to everyone?
Yes, sir.
Right. So due to these reasons, H influenza, especially in those countries where medical care is better, is not the now major cause of acute pyogenic meningitis in infants. Now the most common organism is, yes, now presently the most common organism in infants, especially in the developed countries, is Streptococcus pneumoniae. Streptococcus pneumoniae. Here I should mention one more thing. Streptococcus pneumoniae is otherwise also most common cause of meningitis, right? If you take the total cases of meningitis in a community from infant up to the old age, Streptococcus is the single most important cause of meningitis. Is that right? In old age especially it is very common, but now it is also common in infant because cases of H influenzae are being reduced, especially in developed country. So Streptococcus pneumococci, and other organism which can also you put it here is, yes, in infant and other children, 2 year, 3 year, 4 year, Streptococcus pneumoniae, and yes, I will give you a hint. Other organism here is the most common cause of meningitis in this group, young adult. Neisseria, yes, Neisseria meningitidis. I don't know how to pronounce it well, but anyway, we can call it for a while Neisseria meningitidis or tidus, whatever it is. You are free to call whatever you want to call, but remember it is there, right? So Neisseria meningitidis, right, is a very important cause of acute pyogenic meningitis even in infant and young children. And it is the most important cause in adolescents and young adults, especially who live in close quarters. Is that right? Now we come to in detail of Neisseria meningitidis. Neisseria meningitidis. You know, in my days, when I was a student like you, they were good days. We don't call tidus, we just call it meningococci, right? So, meningococci, right, or Neisseria meningitidis This is the most common cause of acute pyogenic meningitis in adolescents and young adult. And after that, in the adolescent group also, you can put streptococci. You can put streptococcus pneumoniae. But you can put streptococcus pneumoniae. But here it puts a very heavy burden in very old age. Streptococcus pneumoniae produce very heavy burden in old age, right? Now, few words about Neisseria meningitidis, because this is a very important organism. Sometimes it produces meningitis in a sort of epidemic, so multiple cases come in clusters, and sometimes big human tragedies occur. You know, in 1996, in sub-Saharan Africa, 250,000 people developed acute pyogenic meningitis with Neisseria meningitidis, and about 25,000 patients died. That was the biggest recorded in human history, the biggest meningitis epidemic, right, in sub-Saharan Africa in 1996. There are a few more important things and dangerous things about it. Number one, Neisseria meningitis produces very severe meningitis, and this is a kind of meningitis which can kill the patient sometimes in hours and rarely in minutes. Patient just come to you, or even many times patient don't reach to the doctor. They are just telling their family people who are having severe headache, and then gradually they develop drowsiness or dizziness or fluctuating conscious level, and with that rapidly appearing petechial rashes, and even before they are taken to the proper medical facility, some of these patients die. It's so fulminant and severe, right? So let's focus on this thing. Neisseria meningitidis, right? The culprit. Young adults, right? From where this organism come? Yes, who will tell me? From where this organism come? And don't tell me it come from vagina now. Yes.
Nasopharynx.
This is right, it is airborne, but actually it is carried by approximately 5% of the population as part of their nasopharyngeal flora. Again, I will mention that humans are the only natural host. Humans are the only natural host, right, for meningococci or Neisseria meningitidis. You don't get it in cow or fish or elephant, right? Humans are the only natural host of this organism, and in about 5% of population, these organisms are part of their transient upper respiratory tract flora, right? Especially in nasopharynx. You know, these organisms have special type of fimbriae, and they stick to the nasopharyngeal epithelial cells, right? It's 5%. But the people who live in very close contact, the percentage of carriers goes very high. For example, if I'm carrying this organism, and if I'm living, let's suppose, with some people, 5-6 people living in one room, if I'm the carrier, I will give it to everyone, right? The people who live in very close community or a poor housing situation, right, there the carrier rate can go up to 30 to 40%. Of course, this will be more true about the poor countries and poor localities, or where people are living together very closely, like military barracks or police barracks, or in college dormitories, right, where many students live together, right? In one room there are many students, or in a very big room there are 10 students with beds. If one of them is having this organism in his throat, right, maybe he will gift it to everyone around. So what I'm saying, generally speaking, about 5% of human population, 5 to 10% of the human population is a carrier of this organism. But in people who live in very close contact, 30 to 40% of the people may have this organism present in their nasopharynx. But of course, everyone who is carrying this organism does not suffer with meningococcal meningitis, right? There are many steps which eventually lead to that situation. But here I would like to mention one thing, that about this organism also, now we have vaccination programs. right? Vaccination programs, and those vaccination, there's a polyvalent vaccine, where is this meningitis? Polyvalent, right? Which has A, C strain or type, A, C, W135 and Y. Against these, right, this is a vaccination, polyvalent vaccination, which is made so that it can protect the person against type A, C, W135 and Y. If you cannot remember all these, no problem. But remember, there is a vaccination against meningococci, and this vaccination is actually recommended for every young adult. Of course, everyone in the world is not getting it, but at least it is recommended for every young adult. Every young adult or every adolescent must get a shot of this vaccination, right? And this vaccination, when it is not available or many people don't get it, right, then of course they become vulnerable to this organism. Now there's one more question. One way to prevent this is by vaccination. There's another way to protect. Sometimes what happens that, let's suppose you have one patient with meningococcal meningitis. Now this is very important. Listen it with your both ears, right? You end up with a patient who has meningococcal meningitis, acute pyogenic meningitis. You know, the first thing should come that you have to give antibiotic immediately to this person, young man. And second thing what you have to do, after taking proper sample, you have to worry about his close contacts. Before coming to hospital, maybe he has given to his family members or friends or boyfriend, girlfriend, wife, husband, or secret friend, whatever, right, or children. So what happened that because this lives in the nasopharynx, and when you are sneezing or coughing, right, it can come out, or kissing, right, it can reach to the other person, right? So close contacts should be protected. So when you receive a patient who has a well-documented case of acute pyogenic meningitis by Neisseria meningitidis, right? Of course, you are going to treat the patient appropriately, but you have to take care of the close contacts, because organism has gone to the close contact people, family members, friends who are very close. How you will protect those close contact? Question goes to, yes, doctor. How would you, what you will do for the close contact of the index case? Index case is the patient who came, yes.
Polyvalent.
Oh, my friend, now you don't tell me polyvalent, because let's suppose if I get the, I'm not so young to get meningococcus, thank God. Okay, he's a young man. So if you get, God forbid, Neisseria meningitidis as an organism for your acute pyogenic meningitis, and if you have some, let's suppose, girlfriend, right? We cannot give her vaccination, and vaccination will take long time, right, to produce antibodies. We have to do something that rapidly her throat should be clear of organism, because you have given to her or people around. Or if you have babies, maybe babies should be given something so that immediately kill the bacteria. You are already in hospital and your family or close contact need to be protected immediately, right? We cannot wait. We can give this, what is this funny thing? Vaccination, but it will take a long time. We want to kill the organism immediately. Not antiseptic solution, we need to give some antibiotics, yes.
For adults, ciprofloxacin.
Very good. For adult, we give ciprofloxacin. What is this? Prophylaxis, ciprofloxacin. For adult, we call it chemoprophylaxis, right? This was immunoprophylaxis. For close contact, we must do chemoprophylaxis also. For adult, we give the ciprofloxacin, and for children, we give
Rifampin.
excellent rifampin. Yes, Dr. Nadeem, why these two antibiotics are very important to eradicate the meningococci?
To eradicate
Yeah, from the, I agree that in the close contact of the index case, we give adults ciprofloxacin and children rifampin so that we can eradicate the organism from the nasopharynx or throat. But how these two organisms, because how these two drugs very effectively remove the meningococci? Answer is very simple, because these two drugs are secreted in saliva. These two drugs are secreted in saliva. Patient will take it orally, and then it will go from gastrointestinal to the blood and then concentrate into parotid gland and come into saliva. And in the saliva, when these antibiotics appear, the saliva is being painted on the nasopharynx and pharynx and other throat structures all the time, right? That will help you to eradicate this organism. Is that right? Now we come to the old age, right? And in old age, the organism which I told you, one is streptococcus, coccus pneumoniae, and other is, okay, old name of streptococcus pneumoniae is pneumococcus. Yes, you are right. And other is listeria. Again, this listeria at the beginning of the life and at the end of life. Listeria monocytogenes, right? So streptococcal pneumoniae, right, in especially older age, as your age become more and more, you become more vulnerable to this organism produced meningitis, especially the people who are alcoholic, right, or people who are asplenic, where spleen has been removed, because spleen help in producing antibodies against streptococcus pneumoniae, right? Or the people who have history of basilar skull fracture with rhinorrhea, basilar skull fracture with rhinorrhea or with CSF leak. From there also pneumococci or streptococcus pneumoniae can enter into, reach to leptomeninges or CSF and produce a problem. Is that right? And then other is the listeria we have already discussed. What is it? Gram positive, intracellular, anaerobic bacteria. Again, in old age people, from where they will get unpasteurized milk, unpasteurized cheese, unpasteurized butter. Don't tell me unpasteurized meat, undercooked meat. Deli meats, or you can say undercooked hot dogs. Again, you remind me of the hot bitches, right? Let's have a break and then we'll go into detail the pathogenesis of meningitis. Then after this break, we'll discuss exactly how this organism, will take a classical example of, let's suppose, meningococcus or pneumococcus, how it really reaches to central nervous system and how it starts damaging the meninges, and what really goes on within your patient's skull, right, after the break. Thank you.